to like failure, or let's talk about not finishing things that we start, and how quitting can sometimes be a great decision. So I stopped that program, and my reasoning for doing that was I was experiencing a season of burnout. And this was also during the midst of COVID really ramping up. And what I realized was my response to COVID and how I was coping through that was overproductiveness. Let me do more, do more, do more. Let me try to stay busy to help pass the time. So I enrolled in that program, and I just could not do it. And then I couldn't complete it based on the current mindset that I was in and the place that I was in around everything that was happening in the world. So I did not finish that, stop that. I'll say I left it on red. Just kind of left that there.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Welcome to episode 125. Hi everyone, I'm Omari Richards. Thank you all so much for joining me today. If this is your first time joining, welcome. Be sure to subscribe so that you don't miss great public health content like this. And if you're a returning listener, be sure to leave a 5-star review. It really helps the show get out to more people. And also, don't forget to follow me on Instagram at the PH Millennial. I thoroughly enjoyed today's conversation with this nursepreneur and public health consultant. She's a go-getter and did all the multitasking while pursuing school and then work and then more school. She was a nurse, transitioned into a more public health work. Today, we have someone dedicated to people, a motivator, connector, health and IT enthusiast. She got her bachelor's in kinesiology and fitness leadership at the University of North Carolina at Greensboro. She then got her Master of Public Health at West Virginia University. She's committed to the field of public health by holding 2 roles, one as a health service officer in the U.S. Public Health Service Commission Corps Ready Reserve, and as a project manager at the University of North Carolina at Chapel Hill Injury Prevention Research Center. We have Toska Cooper, MPH CHES. Welcome to the show.
Well, thank you so much, Amari, for welcoming me to the show. I think I threw you off with a little tongue twister at the beginning of the introduction. A lot of different words to put together. So but thank you so much for the opportunity to have a conversation with you, and I'm looking forward to the discussion.
Truly is my pleasure. Definitely was a tongue twister, and I'm excited for you to explain more about what that work entails, because it was a long title. So how are you doing, and how are you coping during these times?
So I'm doing really well. I am actually on like a nature break from work. I've been taking some time away to just reset, feel re-energized, refocused on work, but then also just other like professional and personal interests. So I'm at a place where I feel really good in mind, body, and spirit. And I would say that's my check-in, like my temperature check as to how I'm feeling today. How are you? What's going on with you?
Well, first of all, that's important. I'm glad that you're able to take some time in nature, or however that looks to you, to nurture yourself and focus on your well-being, which is important. I am doing well. Another day in the office, another day having a great conversation with people. But start of the work week, it's a Monday, but it's always good to get some stuff done on a Monday. So tell us.
I hear that. I hear that. Me getting things done. My Monday today has looked like going to a state park, enjoying rocks and trees and fall. So busy. Very busy.
That's the type of busy we need. More people to be that kind of busy. So I hope that you're able to soak up all of that enjoyment. Tell us, how do you identify, and tell us a little bit about your personal background?
Yes, sure. So When I think of how I identify, something that people would say about me and I say about myself is I am like an adventurer and a learner. So like I'm always trying to get involved with something new or find a way to like better myself or venture out. So I say I'm definitely learner and being like adventuristic, if that's a word. If not, I just made one up. That would be my identity. And I would say when I think about my personal background, I am originally from Boston, Massachusetts. I grew up in a rural part of North Carolina. I spent most of my life living in North Carolina, a couple of different places, more so for school or for work. Lived in West Virginia and Minnesota, so I like really cold places. Um, Trying to think other things. I am very much into active, like a lot of activities, as in, obviously, I mentioned I'm on like a whole nature thing right now, but I'm also into gardening. Very big on like community service, volunteerism. And then when I'm not doing anything, like just sitting in the house and binge watching shows feels really good. So, a wide range of, I guess I would say, things that define me and who I am that are on like a more personal niche. And there's probably some things I left out. So if people who listen to this are like, Toska, you didn't share blah, blah, blah about you, but maybe we'll get to that later.
Maybe we will. But yeah, I love when people share like more of their personal backgrounds and their personal interests, because everyone that's coming on this show has an interest in public health, has a story in public health, has a heart to save community. But I think really getting that personalization of like what people really like, what they enjoy, just adds another element and another layer and makes you more human. So thank you. We appreciate you sharing that. And like in all of that, what does public health mean to you?
And now a quick break from our show sponsor. Have you been interested in connecting with a community of people who are passionate about community health while working on improving their own personal well-being? Well, lucky for you, the Community Health and Wellness Discord server is where you want to be. It's a free online community I co-created just for people like you. You'll find friendly people talking about important public and personal health topics, asking amazing questions, sharing valuable information, while connecting with each other to build a better culture of well-being personally and at the community level. Join this free online community by going to thephmillennial.com/join. That's thephmillennial.com/join. See you there. Now back to the show.
Ooh, $1 million question. So public health for me is everything. And that may be like a really cliche, typical answer. But I think when I first thought about public health, I just thought of like health departments and where people work. But now that I've been working in the field for several years, I'm seeing that it affects us from a physical standpoint, emotional, sociological. So many areas of our life are around health and public health. So it's more than just the place you go to when you need something like checked on. And I think my viewpoint of that has grown. And then also society has probably seen public health to be a much larger component of our world, especially with things that have happened, I say in like the past 3 years in relation to like COVID and other, I don't know, just issues, crises, things like that. So for me, it's an all-encompassing term that extends just beyond what you might see people do.
Yeah, I appreciate that. And it's a conversation that I have with my partner all the time around like public health, and public health doesn't have to be around like CDC or local health departments, because that's what
Right.
a lot of people going into the field, they're like, okay, there's this one thing, or I need to work in these specific kind of organizations. But I feel like the more that you're in the field, you realize that public health is literally everywhere, and you can have a public health related job in so many different aspects and not really know it's a public health related job
Mm-hmm.
until you know more about what actually public health is, which is everything. So yeah, that I think that's
Right.
important. And then like going back to your personal background and the things that you like to do, I think like all of that is also part of public health. Like you liking to garden and going to state parks and all those different things is a part of your health and your culture of health. And yeah, so I appreciate that. And then getting into your collegiate story. So you got your bachelor's in kinesiology in fitness leadership at the University of North Carolina at Greensboro. So what was the thought process going into this degree?
Yeah, that is always something I reflect on, is how I got started, because even though kinesiology is like a health related field in some way, so it connects to public health, I still had no clue I was going to end up in public health. So I came into UNC Greensboro, which I may also call UNCG, just so y'all know what I'm talking about. When I started, I was a nursing major. And I started out as a nursing major because my mom's a nurse. Well, now she's retired, but she was a registered nurse for like 30 years. And I didn't really know exactly what I wanted to do, but it was like, hey, I know I'm gonna go to college. Nursing seems like a safe bet, so let's just go ahead and give it a shot. I believe I got maybe through my first year and maybe midway through my second, and I was like, yeah, I definitely don't want to do nursing. And I think it was a chemistry class that literally took me out. Like,
all this chemistry.
nah, we're good on that. Yeah, like that's like the stopper, right? Like that's gonna make or break your career in that moment. So anyway, I was like, okay, well, what do I want to do? I know I still want to do something health related, but like, what other interests do I have? So then I'm like, okay, well, I like fitness related stuff. So maybe there's something that's fitness oriented and still kind of healthy. So I just kind of landed in kinesiology because of that. Really fell in love with that discipline. And then I chose the concentration of fitness leadership because I thought that I wanted to go into the world of personal training. So that is kind of how I ended up there, I'll say. But it was a selected pathway, but that's how I got there.
Okay, and that makes sense. And I think like the things that I always highlight around this point is that you started off wanting to go into nursing, and that gave you like direction into like wanting to do health things. And then while you were there, you're like, chemistry, this is not it. This is not where I need to be. And
Nope.
like still pivoting, still wanting to do like those health related health, like helping other people, and falling in kinesiology, which I think is also like a health related degree, not so much public health. And I'm guessing we'll get more into
Right.
like the public health parts of things. But what were some big takeaways that you had from undergrad and doing kinesiology and finishing up? Did you still want to become a personal trainer?
Yeah, so big takeaways for me. So one of the things that I really took advantage of throughout my undergraduate degree was being engaged in the university. So I was not heavily engaged in my department. And part of that, I think, was I don't really know if I need to get to know my professors. And I also switched into that program a little later. But I was very engaged throughout the university. And I believe that developed a lot of leadership skills. It developed my networking capabilities. And then it also was just an opportunity for me to just grow as such a young adult. I went to school as a traditional first year student, so I was like 18. And then I finished when I was like 21, 22. So during those years, I really felt like the organizations I got involved in, the Student Government Association, the National Panhellenic Council, what else? Oh, Housing and Residence Life, all of those organizations really helped shape me and build, I think, a lot of foundational leadership characteristics that I have now. So I like emphasize that because I think sometimes people can put too much focus on the grade point average and not the things that can support that grade point average, which I believe is strong engagement with whatever university you go to. So a big takeaway for me, like I said, being involved with those organizations, joining the best sorority ever, Zeta Phi Beta Sorority Incorporated. But I think all those things really were just opportunities that are priceless, something that I can't put a price tag on.
Yeah, and I'm glad that you highlighted that, because it is more than just your GPA. It is those other experiences, and I'm guessing like throughout all those other experiences, you not only build community but gain a lot of like leadership and other types of skills that you could take and use in different positions. And I know a little bit earlier in the interview you said that you like to do new things, and it sounded like you got involved in a lot of different organizations throughout your bachelor's program. So was that something that you were always used to doing, like from high school time, just like being actively engaged in a lot of new things, or was that something that you cultivated during your bachelor's years?
Always doing it from high school. When I was in high school, well, I started doing 4-H club. And 4-H club, for those who aren't aware, is basically usually a county-run program that allows teenagers to get engaged in activities that might support their just healthy development as a youth. So I learned about snakes, I did rifling, I did all types of things. So I started there with my engagement. Then I participated in like a Rotary Club. And then also when I was in high school, I participated in Key Club. And then there were probably some other things that are slipping me right now, but I was always very much like, I need to find ways to do more than just school, and ways to also just like have fun, make friends. So yeah, it started before my undergrad degree, absolutely. And then it just kind of carried into that. I think I was more driven to do it in my undergrad degree because I already had some experience in high school.
Yeah, and that makes sense. And that's a good quality, I feel like, to have, especially early in your collegiate career, is just like taking on all the experiences, delving into all the organizations, really getting your feet wet to not only build that community, but like, as we said, gain experience. Okay, so you graduated from your bachelor's in kinesiology from University
Yeah.
UNCG, and then you went into the AmeriCorp program. And I know a little bit earlier you said that you wanted to be a personal trainer. So what was the thought process in going into the AmeriCorp program?
Yeah.
Share that a little bit more with us.
Right, like how we got there. Okay, so walking us back to like finishing up my undergraduate program. So in there, I had to complete an internship, and I was so I decided to do this at a place called Prolific Park, which is in Greensboro, North Carolina, where I was learning the ins and outs of what it would be like to be a personal trainer. So you have to complete so many hours, to fulfill an internship. And at the conclusion of all of that, I was like, okay, well, I'm going to keep working here if they hire me. Yes, they did. Yay. So I stayed on, but they were like, hey, you need to go get a national certification. I decided to pursue the American College of Sports Medicine one that was focused on personal training, which the name might have changed by now, but it was the personal training one. So I had studied for that, and my degree program had somewhat prepared me for it. And then I went and failed the test. So this was an opportunity to be like, whoa, wait a minute. Am I failing this because I'm not going to do this? It's like, is life over? Because at 21, 22, it's like very dramatic as of what I'm going to do for my career. But in, I think, those months of really being down about it, I was able to think about, well, what else would I do in college that I really enjoyed? And it was the community service part. So I remember going back and talking to one of my mentors at the time and being like, hey, so I was really into this. What do you think I could do with this? And they were like, well, have you heard of the AmeriCorp program? And I'm like, no, what is that? So then they explained that what AmeriCorp is and how it has provided opportunities for people to even work outside the state and do a year of service on a national level or on a local level. So I explored the program more, chose the VISTA program. So AmeriCorp has several different avenues. I know that there's VISTA, which is Volunteers in Service to America. There's NCCC. There's state and local. And then there's also, if it hasn't started yet, there is going to be Public Health AmeriCorp. So I was in the VISTA component, and I just selected a program. Well, I won't say a program. I selected an organization that was, I don't know, not fully aligned with, I guess, what I thought I wanted to do, but they were about helping people. And the focus of the organization was around workforce development. And I said, well, jobs are important. I do like trying to help people get better jobs, and they would pay for my relocation if I moved to Minnesota. So it was like, okay, this is a win-win. So why not give it a try? Which then led me to getting accepted into that program and doing my year of service in Minnesota, which is really a life-changing experience where I, like I was saying, I worked in an organization that was focused on workforce development. The program that I was serving in was around providing women, well, single working mothers, better job opportunities. And this is my inkling to public health and how I found public health, was in that there were two major barriers, and one of those was educational attainment level and then substance use. So I was like, substance use, this seems intriguing. People always use drugs, but how does this affect how people get where they are in life? So then I was like, where can I do more about research on drugs? Or this might be a way to kind of get my career started around health and preventative stuff. I didn't know just yet, but so yeah, that's how I think stumbled into public health. Post undergraduate degree, post failure, presenting an opportunity to then do AmeriCorp, to then start more on the pathway that I'm on now.
Yeah, failure
I know
is
that
just
was a lot. So
no. I love it. I love it. I think failure is just redirection, and to highlight in your story is it's like
absolutely.
It's like that you need mentors or just people to show you different options in life, because many of the times we don't know. We only know as much as we're exposed to, and we need to have more exposure, more experiences to really know what is out there. And like to that point, you wouldn't have known about the AmeriCorp program, but it was really helpful in that sense that you were able to do that 1 year and support an organization not doing the work that you specifically wanted to do, but in doing that work, you learned about these barriers and about like the deficits around substance misuse and how that applies to workforce development and people getting actual jobs, which I think is important. And you said you also learned about public health. So when specifically did you know about public health?
So I specifically knew of public health. Well, okay, I knew of public health a long time ago, I guess, because as I mentioned, my mother being a nurse, she worked in a public health department. But because of that, that created one lens, very monolithic. You go here for this. Didn't know that public health is what it is now. So I guess I'll take the question this way and look at it like, when did I know public health to be beyond my single view perspective? Was during my participation in the AmeriCorp program, and a colleague of mine was getting her master in public health. And I was like, oh, you can actually go get a master's degree in this? Like, wait a minute. Oh man, like it's a whole new ball game now. Like, wait a minute. I don't have to just go into a medical field or something, like, or be a physical trainer or do physical therapy. Like, hold up, we might have something here. So that's when I really got a good overview of what public health looked like, and then how the work we were doing fit into that. So like, not only were the women, we were trying to get them better jobs by helping them get into maybe a GED program or an associate's level program at a community college, but we were also providing meals, childcare service, and then teaching how to like make different meals. So there was like that nutritional component. There was the a component of youth and child development. So you have like a lot of different areas of public health that were happening in my workplace environment that I just didn't know till somebody gave me the light, like the light bulb, and I was like, hey, you already engaged in this. Now you just got to find what drives you, like what you're most closely connected to. So yeah, that was that was that moment.
Yeah, awesome. And that makes sense. And I think like even to that point of having a mom being this in a health department, but still not realizing that there's a vast plethora of roles and jobs in public health, and how expansive it is to relate to life. And in you learning more about that, and in learning about your colleague that has your master of public health, it's like, okay, we're doing work that fills and helps the needs of the certain community. And I guess into that perspective, you learn more about the social determinants of health, maybe even before you understood what the social determinants of health were, but knowing that there are all these different factors that people need fulfilled in their life for them to be able to be successful in getting a job. And that's the case for many other things in life. And creating those social circumstances or giving them the resources such as the education is just important parts of that bigger picture. So that makes a lot of sense. Okay, so you got your master's of public health at West Virginia University. Tell us more about that thought process from learning more about the MPH to actually saying, okay, this is something that I want to pursue.
Yeah, so a nice part, I'll say output of the AmeriCorp program was an educational stipend. And when I first applied for the program, I knew that was an option. So I was like, all right, I can either get the cash or the educational benefit. The educational benefit also is more money. So I knew that that would help me in getting a master's degree, also coming from a background where people in my family did not have master's degrees. So I didn't have, I'll say, some of the maybe tips and tricks on how to get one or how to pursue assistantships and different financial assistance opportunities. So I was like, well, I need money to go to school because nobody's paying for it except me, unless I can find a school to pay for it. So, and given that context, that was also something I kept in my mind as to what I wanted to do next after finishing my year of service. So my year of service is wrapping up, and I'm thinking like, okay, well, I know I want to get an MPH. Where do I want to get it from? Well, then I was like, well, I want to do stuff around drug use. So then I was like, well, what type of drugs? And I was like, let's go with opioids. And part of that was the experience that I had in Minnesota. And then part of that deals with just things that I've experienced over the course of family, friends, people that I'm connected to have also worked through recovery services. So I was like, well, maybe this is a fit, this area. Now I got to find a place that I can get the most exposure to that. And I'm sure that a lot of people listening are not surprised that opioid use is high in the Appalachia area. So West Virginia University was an opportunity for me to be heavily engaged in a population where people are using drugs, and I can find a way to contribute to providing safer drug use and just explore more of what that can look like. So WVU seemed like the place to go. I mean, I applied to other places and settled in West Virginia for that sole reason. But then also, I knew that it was a place where I wouldn't be lost in the sauce, I'll say. I wouldn't just be a number. I knew that the school size was smaller, and then the concentration I chose, social and behavioral health sciences, was a smaller department. So I just knew that it would be a better fit also for what I was needing, with being just nervous about getting a master's degree and what type of rigor that would be like. So I think I answered your questions, how I got there and why I chose WVU.
Yes, you did. And I think that's
Okay.
that's some key insights there, and like knowing that you might be going into this program, knowing that you mightn't have all the supports from family to know like what this experience is going to be like. So ensuring that you're in an institution that you get the most tailored help and support. And as you said, like you're not lost in the source. You are an individual that they can really look at and learn from, which is important, as well as thinking about, okay, what are the things that I want to do during my MPH program? And from the AmeriCorp, it was opioid use. And then you're like, okay, it was substance misuse. And then from that, you're like, okay, what substances do I want to deal with? Opioids. And then, okay, what's a great place to look at that? And West Virginia, Appalachian, am I saying that correctly? I don't know. People give me tell me I say it wrong all the time.
You know what?
Appalachian,
So, like,
Appalachian. If you
it's just there you go. We're gonna go. Yep, there you go. You got it. You got it.
Yeah, because being from living in North Carolina now, I get some shit for that sometimes. But anyway, but yeah, that I think it's important. I think it's important to like figure out what are those things that you need from a program, and then seek out the programs that are going to give you that. And to your point, you did that with a smaller university, as well as with a university that has communities that you can work with and do a lot of the work that you wanted to do going in, which makes a lot of sense. And you shared your concentration, social behavioral sciences. So were there any big takeaways that you had during your time in your MPH program?
Yeah. So the nature of West Virginia is just unique, and in that a lot of West Virginia is predominantly white. In Morgantown, it looks different because it is a mix of people from all over. You got New Jersey, you have Pennsylvania, then you have West Virginia, you have Maryland. You just have a mix of students from different backgrounds. So the way Morgantown looks is not the face of the state. And when you step out of Morgantown, for me, identifying as a cisgender Black woman, that wasn't always the most welcoming environment. So I share that because adding on the layer of then, well, let's talk about drugs. And it's just like there's a lot of historical, there's a lot of history behind drug use, especially for Black Americans, and opioid use amongst Black Americans and white Americans. And a lot of those conversations, I think, have come to the light maybe in the past. I don't know. A lot of those issues have come to the light maybe in the past 2 to 5, 7 years or so, depending on what you listen to and how engaged you are in this area of research. But my point behind it is when I think of the big takeaway, I think of just what it was like to engage in populations that didn't look like me. And coming from the state of North Carolina, my neighbors look like me. And if they didn't, down the street at the grocery store, they did, like, just much more synergy amongst who I was serving or who I was engaging with all the time. And I think that sometimes that's lost in getting a degree. You're like, oh, well, I'm here for this purpose. Well, also the environment you're in and the community you work with, like, that's something you got to think about, especially in public health. So a big takeaway for me in that was I had to see people beyond, and this is sound what it is, just beyond, like, moving past my judgment and prejudices and things like that I might have thought of people by how they looked. Like, oh, this person may treat me like this because I look like this and they look like that. And then to be pleasantly surprised. And I think that has carried me so far. Like, now when I do, like, health education or things like that, like, I have gotten a lot better at putting my biases out the window and just looking at people for who they are, who they show up to be, and rolling with that, and having I don't know, just not that I didn't want to serve them before, but just more openness to do it without, like, fear or hesitancy around it. Yeah, I think that's, like, a good way for me to kind of summarize. But that's, like, my biggest takeaway is, like, literally being a servant leader and serving with, like, a specific purpose in mind, which is to be there for people.
I love that. And I think that that's necessary. And we all need to check our biases and see where we stand. And I think, like, challenging our biases and say, okay, why is it that we think this way? And then why do we show up this way? And can we show up differently and act differently and do this work? And can we look at people for who they are as people and not just what we think they are or our assumptions of what they're going to be? And a lot of the times it can be hard. That's no doubt about that. But I think it's
Yeah.
important. It's very important to acknowledge it, and from there, that's the only way that you can move forward is acknowledging that, okay, I may have a bias. Okay, why is that? And then digging deeper into that and seeing if that makes any sense, and really
Mm-hmm.
this disproving that bias, I think is something that we don't do often enough, but important takeaway, and I think a great one for anyone that's doing any type of work in public health or just in community in general.
Absolutely.
Yeah. And then you graduated from your MPH program and you became a public health consultant at the North Carolina Department of Health and Human Services. So how do you come across that, and what did you do in that position?
Sure. So coming across that role, well, obviously I always wanted to like step into seeing if I wanted to work in like a state health department setting. Like, would this be a role for me? And when I finished my master's program, I did not have a job lined up. So I think sometimes people be like, oh yeah, like you got this degree, like you're good to go. And I'm over here like, no, girl, I'm about to be in shambles because I don't have a job and I can't be this excited about this accomplishment because of that. And if somebody out there listening and that is you, many of us have felt that. And it is an okay feeling to have, but it doesn't take away from the accomplishment of obtaining whatever degree or certification that you have. So that's something that I really had to keep in mind as I was job searching. So, so getting to how I got into that role and what I did was getting that role came from a lot of networking. So something I didn't, I guess, share too much because I harped on it during an undergrad degree was while I was at WVU, I also was engaged in student organizations such as the Student Association for Public Health and Mount Miniature Recovery. While in those organizations, I made good relationships with faculty members that knew what my interests were professionally, and then also where I was trying to live thereafter my degree. So a position opened up within the North Carolina Department of Health and Human Services, specifically the Injury and Violence Prevention Branch, and it was a temporary role to serve as a program consultant, where I was working on a project that was specific to examining workers' compensation claims and if there was opioid use. And that was a very beginning project, but what was really neat about it was I had the opportunity to really just kind of like dive in, and I was a team of 3, but mostly me being the one who was reviewing the claims and then reporting to my supervisor, and then also speaking with the medical examiner just about how these claims look and how they were classified. So it was a very beginning short-term project that lasted me about 3 months. So it was on the, because as I said, it was a temporary role, but it was my first step into a role post-master's degree that allowed me to kind of see what public health looked like after I got my degree and how I could use some of my skills in the field. So yeah, that's kind of how I ended up there and what I did. Short stint, but meaningful work, I'll say.
always meaningful, no matter the time. And I'm glad that you mentioned that you didn't have anything lined up, because I think that is the case for a lot of people, especially in today's world where it's a crazy world out there. So just know that you have to rely on the people that are around you, the mentors and everyone else out there to really help and support you. But at the same point in time, you have to put in that work for yourself to find those positions as well. Can't only rely on others, but you should like put out the word either way. But that makes sense. And you were able to get a job as a program coordinator at the UNC, or University of North Carolina Injury Prevention Research Center. So how did that process work? Because you said you graduated, then you were able to get this contracted job for 3 months, and then you moved into this other role. So was it that you were looking and applying for jobs while you were in that contracted role, or how did all that work out?
Yes, so yes to that. And then I also was actively looking during the last portion of my master's degree. So this was unique where I was applying for jobs towards the end of my degree. A temporary position came through. However, then the position at UNC was going to come through, but it was basically around a funding component as to, okay, this position will open once this amount of funding is available. So the timing thankfully aligned perfectly for me, where I really will say I started like full-time employment with benefits about 5 months post-master's. So it wasn't a long period of time, but it felt long when I didn't have something concrete. And then also just hoping that like funding works out for me, because sometimes with soft money, it don't always happen like that. But anyway, so yeah, so that's how I ended up at UNC IPRIQ. So we'll abbreviate all of that. IPRIQ, Injury Prevention Research Center, UNC Chapel Hill, so then we don't have to go through the long tongue twister of calling all that out, spelling all that out. So yeah, that's how I got there.
Okay, I appreciate that. And then before I ask you like more about what you did in this role, you said there was that 5 month gap between graduating and like finding a job that has like benefits and everything like that. What was your mindset and everything in that space of time in between actually getting that job? What were the things that you were maybe actively doing to keep yourself going forward?
Oh man, what do you do in between? So when I knew I was graduating and I was like, okay, I don't have a job lined up, I started applying for like anything back home. And the other thing, when I say back home, I went back home and I lived with my mother. I moved back in their house. Thankfully, I was able to do so, got my old room back. It was like old times, I guess. But what I did was I also set like goals. Like, okay, so yeah, I'm here, but I'm gonna apply for this many jobs throughout the week. Or yeah, I'm here, but I'm also gonna make sure that I'm studying for my certified education specialist exam, because I knew I wanted to add a certification behind my name that would then hopefully expedite my job search. Well, not my job search, to expedite me getting a job. So while I was there, it's interesting because I'll say, like, looking back on the time, I'm full. But in the moment, I was like, I don't really know if I'm happy about this. But I say that because I didn't have to worry about paying rent. I didn't have to worry about commuting somewhere really for work. I didn't have to worry about immediately starting a new job and figuring what that was like understanding insurance or understanding what my retirement was going to look like. I was actually able to just kind of go back to the safe space of my parents' house and then be more intentional about my next career steps without thinking about a test or those other things that I had just mentioned. So on hindsight, I'm very thankful. But in the moment, my mind was racing, and it also went back to the failure. Why didn't I get a job? Why are my classmates getting jobs? And I just had to remember, like, it's timing. The position isn't ready for you yet. Like, just being in tune with my spiritual side and my beliefs and being like, you're going to be all right. Like, look at all the safeguards and the support you have around you. Like, it's really going to be okay, but it's also okay to feel how you're feeling right now, too.
Yeah, absolutely. I think it's important for us to acknowledge our feelings, because too many times, especially as men, speaking for myself here, that we are told not to acknowledge those feelings, but like feeling that way is a part of life, and like without those kind of sad times, that makes the happy times, like you need the sad times to make the happy times happy, essentially speaking. But I'm glad in like reflecting on that point in your life that you can take, that you were able to kind of reset when you were at home and be more intentional instead of like scrambling and applying for jobs that mightn't have been the best fit for yourself, as well as it seemed like trying to get the certified health education specialist certification. So were you able to get that certification before you got the program coordinator job?
No, so I didn't get it then. I got it maybe shortly after, not too long after. I'm trying to think. I got settled in my job, and then I believe I got the certification in April of 2018. Because if I remember correctly, it's on a cycle. I haven't needed to retake it, but I believe it's only open during certain windows. So I think that's why I missed it for the fall probably, and I wasn't ready. So I think that's why I took it in the spring. But I might be wrong, and somebody listening be like, "Nah, that's not how it works." But I think that's how it just works.
I believe that's how it works. I don't have my CHES, but I've interviewed quite a few people, and then that's definitely my understanding of it. And I go on the website decently enough to like link it to show notes. So, but anyway, that's not here nor there. What did you do in your program coordinator role at UNC?
And now a quick break from our show sponsor. Do you care about public health and health equity? Have you been looking for value-based apparel? Well, the Public Health Store has got you covered. Rock simple value-based design apparel that will surely have others interested in engaging in meaningful conversations with you. The Public Health Store has apparel for you to rock in class, around the office, or just casually around town. Wear your values where people can see them. Visit the Public Health Store at thephmillennial.com/shop. That's thephmillennial.com/shop. And use the code podcast for 10% off your next order. Okay, now back to the show.
Yeah, so when I first started that role, I was very engaged with the injury-free North Carolina academies. And these academies are training opportunities for public health professionals, practitioners throughout the state to learn more about a topic area related to injury and violence prevention. So the two academies that I was very engaged in were the shared risk and protective factors to prevent violence, and around, I'll say opioid overdose and prevention, because the actual description of the academy changed each year. Like some years it was around syringe exchange establishment, but those are the two topical areas. And in those academies, my role was to help facilitate the training, put together some of the curriculum, recruit the participants, basically I'll say a all hands on deck type of entity to the injury center, or the IPRIQ. And then I also started co-managing some of our projects that were smaller projects to help me transition into the role of a project manager. So that's what I did for about a year and a half before I was promoted to the project manager role.
Well, yeah, thank you for sharing that. And it seemed like, did you take on some of the responsibilities of a project manager before getting promoted into a project manager? That's what it kind of sounded like from that short little snippet you said there.
Absolutely, because that's sometimes you got to learn by doing before you get it all handed to you. So yeah, I started with like just attending meetings where one of the senior project managers was leading the project, and maybe taking notes or setting up the agenda beforehand, sending that out to the principal investigator, the co-investigators, the study team members. So really just doing the lighter, I guess I'll say, work of the project, not too much into the report writing or maybe the IRB submissions or data use agreements or managing a budget. But I would observe senior PMs on how to do that and then get parts of it. And then once I kind of mastered that, then get added on more and more and more things. And then it came a time where it was, all right, we think we can put you on this project, 20%, 30% effort, and then you can take off and do it, because you already were kind of just understudying and shadowing and having parts of it already. So, yeah.
And was it the understanding that you would get promoted into the position, or was it just more so you wanted to take on the more responsibility, more of this role, with the hope for that to be the case?
Maybe both happened at the same time, but so in working in the center where I am, a lot of support was given around, hey, we know that you're taking on these roles, so we need to pay you to do them. So how do we make sure that the funding for this position is available for you? Because in some structures, in the university structure, you have to move around different job families and job categories in order to then be like reclassified and things like that. So working out all the things behind the scenes also made that position happen. But it was very much understood that for me to take on these additional roles, I would then have a title that reflected a title and a salary that reflected that.
Shout out to that. We need more of that out there. Yeah, that's awesome.
Absolutely.
And this is one of the roles that you currently still hold. Have things changed a lot over the years and into the work that you're doing now, or has it mostly been a lot of the same project management type role, but just like different topic areas or different like projects or whatever the case might be?
Yeah, so some of I would say the work involved with the projects might change. There's just things that are going to happen in any project. Like you're going to have a project kickoff, you're going to have a project closeout, and there's going to be money involved, and there's going to be deliverables and things you need to execute to make the project happen. That's just going to happen no matter what. Now, in some of my projects, I've gotten more involved with creating some of those outputs. So creating a website, actively blogging on that website, uploading code, uploading poster presentations, creating repositories. So I've been very engaged in some of my projects, which I wasn't doing when I first started. There's also been an opportunity now for me to shift into, I'll say, like managing a suite of projects. So in the world of project management, we might call that more managing a portfolio and having projects that are all related, but kind of doing different things. So I've had some experience in doing that. And then also now getting to a point where helping with applying for large proposals for our center, grant proposals, and then also participating in the annual reporting part where I'm actually writing the reports, uploading the data, exporting it. So the role is still project management. It just also can look a little bit beyond individual projects that I've been assigned to, where I'm doing work for the greater good of the center, and then also having a piece of leading our equity working group, where we just kind of started about 2 years ago now, to really focus on how we can be more equitable in our center, but then also the research teams that are involved in the work we're doing. So the work has kind of expanded. I definitely can say that I've had opportunity for growth.
Okay, that's great to hear. And would you say what are some of the biggest, if you had to give like advice to someone that is going to go into project management, what would some of that advice be? I'm guessing like organization is probably one of those top things that you let them know they have to keep a hold of. But what are some other things you give them advice for?
Yeah. So definitely organization. You have to be organized. One of the things that I think some people miss is having good interpersonal skills and soft skills. Because when you work on projects, you may or may not know every member of the project team, but you have to work with all of them. And you'll have to figure out what their work styles are like, what's the best way to communicate with them, what type of cadence do you want to set up, when do you need to step in and lead, and then when do you need to kind of just take a back seat and just kind of let the chips fall where they do, let the project leader have at it. So being able to read the room, have good interpersonal skills, also being able to have good follow through. Like you have to follow through on the things that you're doing and be able to communicate verbally and in written communication styles like email, report writing, also being able to talk to different audiences, different stakeholders. So that was probably a lot of advice that I gave there. But if I could narrow it down, I would say communication, interpersonal skills, time management, reading the room, and then leadership.
Yeah. Well, thank you. Thank you for sharing those. I think those those really are important. And I think especially like that interpersonal skills, people might be thinking of something that's important for a project manager, but when you're dealing with a lot of people who can be difficult sometimes here and there, definitely see the importance of that. And I believe also with your work with UNC IPRIQ is what you call it, injury prevention.
Yeah, you got it. UNC IPRIQ.
You're also part of this professional organization called Safe States Alliance. So tell me more about how you got involved with this. And I know that you've had experience as a general member, you were a vice chair, you were part of the annual conference. So tell me more about the experience at the Safe States Alliance.
Yeah, sure. So Safe States Alliance is one of the world's largest professional organizations for injury and violence prevention professionals. That's a good one sentence summary, I'll say, in how that looks and how it has played out for me is, as you mentioned, I started out as being a general member when I first started working at UNC, and then I ran for a position to be a member at large on the executive committee. During that time, I was also serving on the annual conference planning committee, just as a general planning committee member, getting more exposure to the organization. I was elected into that member at large role, and then recently reelected. So now I'm in year three of this commitment. And then while I was on the annual conference planning, someone was like, "Hey, Toska, you're pretty engaged. How would you feel to be a vice chair?" And I was like, "Oh, I don't really know, but all right." So then I stepped into that role. It was a great time to be the vice chair because, then we had a pandemic and everything switched to a virtual space the year after. So that was, so much just trying to figure it out. The whole world was spinning, as we know. So no need to get into the weeds about that. But serving as a vice chair, and then this year recently wrapping up being chair of the annual conference. So in all of those roles, I've been very fortunate to work alongside Safe States Alliance staff and then other professionals that are throughout the U.S. And they have all different roles, just like me. Some are project managers, some are maybe they're health educators, some of them might be section chiefs or section leaders in their state health department. So it's been interesting really working with different people to plan 2 conferences over the past couple of years.
Yeah, I can imagine. And I think it's awesome to just hear that you were just someone that was engaged. And then from that, they're like, oh, you can do these more like tasking roles or be a part of like the executive committee. And it seems like you flourished in that and continue to flourish in that, which is awesome. And on that same path of like, you can go ahead.
No, I was going to say, yeah, I definitely did. And then just briefly it's interesting because you get good at something and then people say, oh, well, why don't you do this as well? So then I moderated a session last year, and then this year was a keynote speaker. And just to mention about that was like, people have always said to me, Toska, you speak really well and you engage with the audience and you look like you're having a great time. On the inside, I am probably sweating under my arm. Well, I'm probably sweating under my armpits, down my back, and I'm like real nervous. But I will say stepping into these positions has been so rewarding. It really has made me say, maybe I do like public speaking and finding out more things about myself. So just saying the benefit of professional organizations and what they can really do for you outside of just being connected to the one where you work. But back to you. I didn't mean to interrupt you.
No, you're definitely not interrupting. And as well as I think like stepping into that uncomfortability and being okay with that, because myself still sweat under my armpit sometimes in some presentations, but it's not to say I'm necessarily nervous, but it's just like, I don't know, it's a bodily response to, I don't know, some sort of stressor, quote unquote.
It is.
Yeah. And along the lines of professional development, you've gotten a decent amount of certification. So I've one here that you've gotten as a health informatics graduate certificate at East Carolina University, as well as a project management graduate certificate at East Carolina University. And I think that there were a couple of other certificates that you wanted to mention. So wanted to give you some space to share more about your professional development and what that means for you.
Okay, yeah. So the two that you mentioned first from East Carolina University, what I'll refer to as ECU, the health informatics one, I was like, yeah, I think I want to do tech related stuff. I'm also a SAS programmer, so I was like, oh yeah, let's like do that. Then I was like, nah, I don't think I really want to do informatics related stuff, but I'm glad that I got exposure to it, because now when there's data scientists on my project that talk about R, SATA, Tableau, all that, I'm like, hey, I know what you're talking about. And it just kind of helped me understand a little bit more. So I am thankful that I did get that certificate. And then the other one that was about project management, let's also go to like failure, or let's talk about not finishing things that we start, and how quitting can sometimes be a great decision. So I stopped that program, and my reasoning for doing that was I was experiencing a season of burnout. And this was also during the midst of COVID really ramping up. And what I realized was my response to COVID and how I was coping through that was overproductiveness. Let me do more, do more, do more. Let me try to stay busy to help pass the time. So I enrolled in that program, and I just could not do it. And then I couldn't complete it based on the current mindset that I was in and the place that I was in around everything that was happening in the world. So I did not finish that, stop that. I'll say I left it on red. Just kind of left that there. Then I'm trying to think, I mentioned that I have my CHES, and that happened in the earlier part of my career. The health informatics one happened kind of around the same time. The project management one I did not finish, and SAS happened actually pre-project management. What I will say for those two certifications from ECU, or certificate programs from ECU, I really pursued them also because in being in an institution of higher learning like UNC, there was tuition assistance provided through the university, where I was like, hey, while I'm here, let me ramp up on the certificate programs and take advantage of that opportunity. So that's where those kind of stopped. And then right now I'm studying for my project management professional certification. And that one I expect to add even more value to my role as a project manager, because it adds the street cred and the letters behind my name to say I'm certified in what I'm doing day in and day out. And yeah, so I think that sums up my certifications or certificate programs. Hopefully, I didn't leave any out. And if I did, it's okay, because I probably was at a phase where I was doing too much. But now I'm like, we'll focus on one, and this is what I'm after. But every experience has been very valuable for different reasons.
Yeah, that's important. And I also want to let you know that it's not failure if you're burning out and you have to stop something. That's definitely success in understanding that you've reached your limit and that you need to pivot away from that. And like to that point is like you can still come back and do it later on, which is something that you are gonna do later on.
Exactly.
So yeah, like timing is everything,
Timing is everything. Yes.
Yeah, awesome. And then you also work as a health service officer at the Public Health Service Ready Reserve. So how do you come across this, and then what do you do in this?
Oh goodness, it's just been wow. So as we've been talking, I'm like, all these things have happened over my life. Wow, it's kind of humbling to hear the things that you've done. But okay, so the United States Public Health Service Commission Corps. So this organization is the only uniformed service that is solely dedicated to protecting, promoting, and advancing the health and safety of the nation. You may have seen public health service officers working in agencies such as the Centers for Disease Control and Prevention, the Food and Drug Administration, the Bureau of Prisons, the National Institutes of Health. The list goes on as to where you may have seen us working. And people that are functioning in those roles tend to be active duty officers. I give that context because most recently, as of July of last year, the first class of officers commissioned in the Ready Reserve were commissioned, and I was in that first group. And what makes it so important to the public health service is that now there is a reserve unit to the active duty, which is very similar in military services where you see an active duty and reserve component. So now the public health service is something similar to our sister services where we're called to activate in the event of any type of response. It can be a national event, it can be a public health emergency, it can be a local, state level event, it can be whatever is needed. We can be called to action, I'll say. So yeah, that's overview of what we do, who we are. How I got connected with this was during my master's program, I wanted to join PHS, Public Health Service, but I did not apply during my master's program. I opted to just go into the workforce. And then I was at a place where I was at UNC and I didn't want to leave yet. And the Ready Reserve came into action after the CARES Act. And I was like, oh, wait a minute, now's an opportunity for me. So I applied, and I guess this was November 2020 or sometime around then. And then after getting accepted and going through all the application process, I finished up training and commissioned in July 2021. So that's how I started and how I got here and in the role of a reservist.
Okay, that's cool. Well, congratulations on being in the inaugural class. That's pretty awesome to to kind of say that. I think for anything, but like specifically this. And I know I've had people from the public health service, or I've had people who work in public health service on the podcast before, but I have not heard about the Ready Reserve, which makes sense that it's like more of a newer thing. So how does that work, being part of the Ready Reserve? Do you have to like check in like twice a year, or is there any sort of process like that, or what does that look like?
Yeah. So we have to participate in monthly drills. So these are called inactive duty training sessions where they are over the course of a weekend, and we have different topics and different, I'll say, objectives that we'll be focusing on for each month. Some of them are around maybe deployment preparation. Some of them may be understanding the incident command system and how we may function if deployed. Other topics may be around emotional well-being. We've had a lot of different things to focus on now that I think about it. It's been almost a year and a half or around then since I've been in. So we participate in monthly drill sessions for a weekend, and we have 2 weeks of annual training to complete every year. So those would be requirements around what we go to. Then we also have to maintain a status of basic readiness. And those are just no different than active duty officers with having up-to-date immunizations, being at a certain fitness level, very similar to also how other services function. So those are the I guess I'll say the bare bones requirements that have to be met in order to maintain an active status and ready and eligible for opportunities.
Okay. Well, thank you for sharing that. I appreciate that. And then before I move you on to the Furious Five last section of the show, I would like to ask, where would you like to see yourself in the future?
Ooh. You know, that question reminds me of when you would come home from college and they say, oh, well, you know, what you gonna do when you graduate? And you're just like, hey, can you pass the mac and cheese? Like, I don't really want to get into all the what I'm doing in the future. But I'm not going to ask to have the mac and cheese passed or the water passed around or anything, because for me, envisioning my future and what that looks like, I envision myself in a role where I am connected to the community I'm serving, but in a way that I'm on like a regional level, director level or assistant director, maybe even a senior program manager. But I still want to know what's going on with the projects that I'm managing. I don't ever want to be in a position where I'm so disconnected that I don't know what's going on in the way that I couldn't speak the language or I couldn't communicate these reports I'm getting to the participants I'm serving. Because at that moment, I feel like I've lost my drive and my why for public health. So yeah, it's got to be my future next step role is one that is more senior level, more leadership driven, but not too far off from people.
Great. I love that, and I hope that you're able to get that leadership progression as well as staying connected to the work and to the community, which I think is a lot of what we want to do in public health, and could be tough when we do go into like greater leadership roles. Okay, moving you on to the Furious Five, the 5 questions that I ask all guests. Number 1.
All right, let's get it. Let's go.
You got this. Number 1, what advice would you give to a student trying to pursue a career in public health?
So the first thing that comes to me is whatever idea or inkling that you have, like explore more of it. Don't think that whatever you're envisioning to do is too far off or silly, or nobody's doing that. Whatever to you and your spirit resonates with you, you're happy about, figure out how you can do more of that. It may not be exactly what you're thinking, but at least explore more of that arena. So that would be the best advice I would give to someone.
Great advice. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
So first, it's like which one, right? Okay. So because it's like wearing 2 hats. Project management, I would say to get into something like that, first find the organization or the industry that you want to do, because it could be public health, but like, do you want to do public health education? Do you want to do public health research? Do you want to do a university level? Do you want to do nonprofit organization? Like, maybe figuring that out first will kind of get you on there, and then see if you can job shadow, or even like a paid internship or something like that, or see if there's a temporary role or a consultant role. And the other thing I'll say is also, don't think you have to start as a project manager. Come on as something else, and then get in there and get to know the project manager. That's another good way in. If you're interested in the public health service, commission corps, active duty, or ready reserve, you can just visit the website, uspHS.gov, find out more that way, around like all the I guess text heavy what you got to do, but also I'm always open to having conversations with interested applicants that way as well. So 2 positions. Hopefully I got that one. All right.
Yeah, absolutely. Appreciate that. Number 3, what's something you are working on improving in your life right now?
Oh, this is a great one. Working on sitting down, not having all these commitments, having time for myself, because for some reason I can prioritize everything else. I can help everybody figure out what to do. But when it's time for me, I'm like, all right, well, I took this time off of work. Now, what am I going to go do? So, no, I'm trying to do so much better at prioritizing myself and then going back to whatever I'm committed to with the excitement I had when I first made the commitment. So yeah, that's exactly my focus right now.
Love that. And I think that is a narrative that we need to hear more of, just finding that time to take care of yourself. Number 4, professionally, do you recommend anything?
So, I feel like I could say like a book, a podcast, or something like that, but that might be a little biased. So, I would say what I would recommend professionally is doing like an inventory check, or like a cleanup of like your resume and like your professional, like, not footprint, but like your professional life that even is outside of your organization. Like, what does that look like? Like, if you were ready to just go out and apply for a job or got an interview, would you be scrambling to find all your stuff and put it together? When do you have multiple copies of your CV or your resume? When you look at that, does it actually feel good, or is it like just words on the paper? Are you excited to read what's on there? So I think that it's important for people to take some time and, clean up their own house and see what it looks like, or make it better, add some modernization to it, I'll say.
Yeah, I love that, because I feel like we don't get enough time to look at our resumes or look at our cover letters until we're like in the heat of looking for a job. But when I think it should be a continual process. So I appreciate that advice. And then last but not least, where can people connect with you?
Oh, I'm a lover of the LinkedIn. So that is like my biggest social media platform that I use. So people can connect with me by just searching my name. It's very unique. So you probably won't find another Toska Cooper. Connect with me. Just be like, hey, I heard you on the Public Health Millennial podcast. What's up? I want to talk about whatever. And I will definitely connect with you and follow up. So that's the best way to, get in touch with me.
Love it, love it. And I'll be sure to link that in the description and the show notes for anyone that is interested in connecting with Toska. But thank you so much, Toska, for coming on tonight and sharing some great insights, sharing your story, sharing your perspective. Definitely is going to be very helpful to a lot of people.
Yeah, well, thank you so much, Amari. This has been, so I also want to say, like, this is the first podcast that I've done where it's been like a full interview and had the opportunity to share some of my experiences. So I hope that for everyone listening, that it's made you really reflect on your journey as a public health professional, or even if you're in another field, just have some opportunity to think back as to what's your why. And I'm just very humble and thankful for the opportunity. So thank you once again. And it's been a complete joy.
I'm glad to hear that, and truly is my pleasure to have you on and share your story. So housekeeping items, everyone. Thank you so much for watching this or listening to this. I greatly appreciate that. If you have not subscribed as yet, be sure to subscribe so that you won't miss any great content like this. If you're watching this on YouTube, leave a like. If you're listening to this from the podcast, leave a 5-star review. And wherever you're listening or watching to this, share it with a friend. I greatly appreciate it, and it greatly helps other people find and navigate their journeys in public health. See you all next week. Peace.